Enad. Once again, we are going to talk about relevant topics in line with our medicine and faith uh, talk series. Today, you'd be surprised why vitamins and trace minerals is related to meditation. So if you like this topic, stay put. Click the like button in the red platform and hang on for 30 minutes because we are going to give you more information. So let's talk one by one. Vitamin D, glutathione. So let's talk about that. We always use that. Uh, I always check the level of vitamin D, which is usually not checked by other mainstream doctors. And there's a lot of reason for that. Even the reimbursement for most commercial uh, insurance would not really be excited about paying for vitamin D level, but it's a very important vitamin. So let's start with that. What is vitamin D? It used to be vitamin D was the vitamin that would help you build your bones, increase your calcium, that. Now we know the most important thing about vitamin D is that it is an immune function vitamin. When you say immune function, we're talking about the lymphocytes. There are three types of lymphocytes. The B lymphocytes that protects you from bacterial infection, the T lymphocytes that protects you from cancer, virus, and there's another type of lymphocyte called NK lymphocyte, natural killer cells. This does not produce antibodies. So hang on there. What is important is lymphocytes. We call the innate immunity, which is pretty much the lymphocytes. This is the baby that we really need to take care of. This is why vitamin D is important. Because vitamin D in itself will works with a peptide called LL37 and cathelicidin. This is a new concept. Say, for example, when there's a bacteria or virus that's floating in the circulation, you need vitamin D and LL37 to grasp this virus and dump it to the the immune system, like the appendix, for example, the Peyer's patches, or the spleen, so that it can be killed and usurped. Depending on the type of organism or the type of antibody response, the B is activated if it's a bacteria, the T lymphocyte if it is a viral infection. And then most importantly is the natural killer cells would, Jose, can you hear from Facebook? Good, thank you. So what happens is the natural killer cells, and I mentioned this before, stay clinging like a bat in the blood vessels right here. They are shaken if you exercise. So that's one way of boosting your immune function. That's why it was wrong for us to stay sedentary or stay in bed most of the time. Oh, you stay in bed, rest when you had COVID. That was the worst advice, because what you need is to exercise to boost your immune function by allowing the circulation of these NK cells, natural killer cells, to kill the bacteria, the virus. Together with the vitamin D and the peptide, it shows immune function that will improve. And in essence, if your vitamin D level is less than 60, that's the usual teaching among functional medicine, you're rendered really immuno kind of deficient, because the level might be in the level of the FDA, that's 30 and above. But what science have taught us was a vitamin D level of more than 60. Some people say 40, depending on who you believe. Thank you, Jose. So, vitamin D. Where do you get your vitamin D? Rumor always has said that Vitamin D can be produced in the skin through the sun. Well, I've seen so many patients who are almost like exposed to the sun most 365 days a year, but then they still have low vitamin D. So why is it? I tried to investigate that because I was also a victim. During COVID or before COVID, my vitamin D level was 22, way below. And imagine my exposure to COVID. Well, it turns out one of the reasons would be that vitamin D level cannot be produced a lot of times because although we see the sun, we are not exposed to the sun because we're most likely inside the building most of the time. In my work, I go out, go to the car, protected by the sun whole day, and you go home, sundown. That's just one example. Vitamin D level is also important. Um, the importance of the vitamin D level is the absorption in the by fat because the fat is needed to absorb vitamin D and to transport the vitamin D. That is the reason why, unfortunately, as we mature, the subcutaneous fat is less. That's why mature men and women have less level of vitamin D because of that mechanism. So it is imperative to check and follow up your vitamin D level the more to get yourself supplemented. And many of physicians or practitioners agree that most of us really need vitamin D supplementation. I still have to see a fresh fresh patients without vitamin D supplementation that has adequate amount of level of vitamin D over 60, and usually um, you would have to see the what do you call this the level above 60. Thank you very much, Big Will, Clean's Filipino nephew, Mr. Clean. Thank you. Mr. Clean is the bald, the but then what is the systematic review and large meta-analysis show for supplementation? Even as low as 1,000 international unit per day offers some protection, but then again, depending on how you absorb it. Another part of the absorption of vitamin D is in the second part of the intestine called the jejunum. This is where the microbiome dwells. This is where the micronutrients and the trace minerals are absorbed. So, in essence, if you're stressed, and that's probably the reason why many people would be predisposed to a common infection when they're stressed, is because the vitamin D level could possibly be low and other trace minerals which we're going to discuss. So it's always good to um, to monitor the level of vitamin D. What about glutathione? The body's primary intracellular antioxidant maintains redox balance critical for immune cell function. We talk about the immune cell function, we're talking about the lymphocyte. Stress increases oxygen radical, reactive oxygen species that kills the mitochondria of the lymphocytes, thus preventing it from operating normally or healthily. So glutathione is needed. We have innate compartment of glutathione, but unfortunately, it also decreases in production as we mature. That's why supplementation is important and eating the food that is rich in glutathione, such as the cruciferous vegetables, broccoli, cauliflower, and um, asparagus, those kind of vegetables. Of course, you can get it from IV glutathione, and also you can supplement yourself with NAC or NAC, N-acetylcysteine. You cannot really take it orally. Um, the You cannot take it orally because it passes through the gastric acid, so it gets destroyed. So you need a precursor or NAC N-acetylcysteine in the form of supplements like NAC. So DRAC 8654 is asking Dr. Enad, please comment on coenzyme Q. Yes, I would definitely do that in a few. So glutathione is related to the optimal support of the lymphocytic activity, with moderate levels favoring DNA synthesis and proliferation of T cells, which is also needed for your protection for fungal and viral and cancer cells. So that is the reason why supplementing these would prevent you from having this chronic illness, including cancer, including chronic fungal infection, and even viral infection. Glutathione, it's very important. The depletion of glutathione impairs the function of the natural killer cells. These are the lymphocyte cells that goes around and increase surveillance like a police to get away those bad elements. It also neutralizes the antioxidants or the oxidants. So it boosts the immune markers such as NK cell activity by 400% if you supplement yourself with adequate level of glutathione. That's why in my practice, I always look for the level of vitamin C and glutathione. It also helps the proliferation of the lymphocytes all together, the B lymphocytes, the T lymphocytes, the natural killer cells. So in essence, it protects you from having bacterial infection, viral infection, fungal infection, and even cancer. Evidence from human trials and reviews indicates glutathione enhances immune responses conditions involving oxidative stress, such as infection, autoimmune function, autoimmune disease like Hashimoto's, multiple sclerosis, celiac disease, and even Alzheimer's. It acts as a modulator than a simple anti-inflammatory, so it acts both. Now, the coenzyme Q behaves the same way. It also is an antioxidant so that it neutralizes the oxygen radicals that is generated when you're stressed. I'm sorry. So there goes the vitamin D, the glutathione. Of course, vitamin C is up there as an antioxidant, but that's a very common vitamin that we can discuss later. The zinc is essential also for immune cell development. What is the mechanism of zinc? Zinc came into popularity during the COVID. Suddenly, people were taking zinc because it has a role in immune function. It supports the innate, which is the lymphocytes, and the adaptive systems of the immune function. It supports the white blood cells, for example, the neutrophils, not just the lymphocytes. The neutrophils goes up when there is a bacterial infection. And of course, the natural killer cells. Zinc is a trace element. You cannot overdose in zinc. That's why you cannot, of course, manufacture your own zinc. The question here from DRAC, would you recommend glutathione replacement therapy with concomitant N-acetylcysteine for APAP overdose? So you choose one, glutathione IV or NAC supplementation oral. For overdose, you need IV N-acetylcysteine or glutathione. Most of the in the hospital is what is available is N-acetylcysteine IV or even the humidifier. So back to this is coming from DRAC 8654. From the macrophages, these are important white cells that are needed also to enact how to neutralize or kill those virus or the foreign bodies, the virus, the fungus, the lymphocytes, and also the cancer cells. Reviews of antiviral immunity is also out there because it also inhibits the viral replication, and overall host resistance. So it's good. Supplement yourself with zinc, and usually zinc is incorporated in many different supplements, including like Immune Active, for example, has NAC, and also zinc in that manufactured by what my the a good reputable. No, Drac, it's okay. Please drop a comment so that we can discuss it. I'm sure they have the same questions like you do. Don't feel bad. What about chromium? Chromium also has a mixed and less consistent evidence for immune benefits. I brought it up because chromium is also used for metabolism. It's known that if you have chromium deficiency, it's less likely for you to metabolize your sugar. That's why a good supplement or trace elements for diabetes or multiple metabolic syndrome is to supplement yourself with chromium. Deficiency increases infection susceptibility by impairing these processes because it decreases the ability of these lymphocytes to, to work efficiently, especially the lymphocytes. So during the COVID, it was known. I'm sure you're still taking zinc and continue taking so because it helps you. The chromium also is helpful in reducing the cortisol suppressive effects. As you know, cortisol increases sugar. So chromium helps that in that way, in that pathway of improving your sugar control. So stress is always there. Stress doesn't have to be that you're depressed or you're fighting on something. Constant stimulus of stress, information, constant um, inflow of constant inflow of uh, information from social media, for example, that can also give you those kind of stress. What a marker for that would be to increase your sympathetic tone, increase cortisol level, which is a stress hormone. The stress hormone increases sugar. The sugar also the sugar also stimulates the adrenal glands to produce norepinephrine and epinephrine that increases your inflammation. So what happens is all these things happen all together at one time. So what happens? How do you neutralize stress? The only thing, please come in. The only thing that really matters in terms of reducing stress or neutralizing the effects of stress is meditation. You can buy any gadget to decrease your stress, or you can go to an expensive vacation to Patagonia, but what really matters is meditation. There are two elements of meditation: guided breathing and mindfulness. Guided breathing, as I have some demonstrated many times, is to breathe a paced guided breathing, meaning you slow down your breathing. People have mentioned, experts would say 6 to 10 breath cycles, inhalation and exhalation per minute. It goes this way: you inhale 4 counts, you hold, you exhale 6 slowly through your nose, and hold 4, and you repeat that. And in a previous uh, lecture, I have demonstrated to a patient where the blood pressure was 160 over 110. On the fifth breathing cycle, it went down to 140 over 90, and so on. On the 10th repetition, it went down to 130 to 110 over 80. So that shows it really is very effective. So I asked them to increase your frequency 20 times in the morning, noon, 3 o'clock, and also in the evening time. One patient who demonstrated the same similar blood pressure, after 1 week without medication, this was provoked by anger from watching news, maintained his blood pressure to 110 over 80 just by doing breathing regularly. So if it doesn't convince you, try Google it, the effects of paced or guided breathing on hypertension. That's just one of the benefits of the meditation. The meditation also improves inflammation, and it's proven in monitoring the inflammatory markers that helps you know the effect of meditation in the inflammation of the body. Meditation helps mental illness because it increases serotonin, which is the neurotransmitter that is, well, the joyful neurotransmitter. So when the circulation increases to the hippocampus, which is the center for joy and also memory. So meditation helps with memory preservation. It decreases the circulation to the amygdala, which is a center for anxiety and depression and anger. So this would help you also prevent yourself from having anxiety. So the more, if you are having stress, your reaction will not be anger. It will be a more compassionate response because your hippocampus has increased in size. Mindfulness, I always endorsed meditating on the mystery of the unconditional love of Christ because it is the most passionate, compassionate uh, manifestation of unconditional love of our Lord. If you go into Eastern meditation like yoga or Buddhism or the New Age, there could be a danger for that because the the type of meditation that they do on mindfulness is centered on self. When you just talk about yourself, it is pride. It is the enemy. It's a friend of the enemy. Do not experiment even to look into what is in there because remember, curiosity breeds some temptation. I just talked to Father McManus, my good friend, 95-year-old saint here in Ave Maria. He confirmed that you cannot play with these bad spirits because they're so powerful. Even invoking their name or by using their name in profanity or even in anger, those are portal of entries of the enemy. When you are when you're influenced by these spirits or bad influence, physiologically it increases your sympathetic tone, anxiety, fight, flight, inflammation sets in, chronic illness sets in, metabolic syndrome sets in, which consists of high blood pressure, diabetes, and visceral obesity. So it is good to meditate regularly. I recommend, as a physician, and I'm looking at the camera, meditate even 20 breaths per minute. And by doing a breath prayer, when you inhale, you say, Jesus, Son of the living God, you hold. When you exhale, have mercy on us, sinners. Hold. Repeat that 20 times in the morning when you wake up, at noontime, at 3 o'clock, and before you retire to bed. It is very effective, and I don't think I can explain further on how I can convince you that breathing, the breath prayer, you can also use uh, the chaplet of divine mercy, which is coming up at the top of the hour at 3 o'clock. By doing this, you inhale, you say, for the sake of the sorrowful passion, hold, you exhale, have mercy on us, on the whole world. I invite you to do that and see how it affects your life. Share this video. If somebody can benefit from this video, it would be great. With this, we can end this video. It will be available in the red platform and also in I think that's a blue, Facebook and YouTube, so that you can drop a comment, share it to some people, friends who might benefit from this. Next week, we will be talking about the role of the microbiome in different diseases. We'll itemize everything from dementia, autoimmune disease, rheumatoid arthritis, for example, mental illness, depression, anxiety, um, and many different diseases that now have been proven to be associated with the bacteria coming from the mouth, oral hygiene, and how it affects as it travels to the different systems of the body. Track 8654, thank you very much. Big Will, 1985. I'm suspecting this guy is my brother from the Philippines, and so forth. James Anderson, Thank you very much for watching. Have a good day. Jose, thank you very much.
Vitamin C enhances the nutritional ability of vitamin D. So should you like have an orange or a clementine before you take vitamin D or go outside in the sun?
Yes, definitely.